MedSpot introduces a new category of healthcare infrastructure, the first integrated model in Europe combining telemedicine, first aid support, ambulance response, and mobile e-nurse services. It connects the physical point of care with remote medical expertise and emergency transportation, creating one coordinated healthcare pathway. This is not simply a medical station. It is a smart, replicable health platform designed for ports, tourism gateways, and communities where fast access to medical support is essential. Κατακόλου is one of Greece's most important cruise ports and the maritime gateway to ancient Olympia. This creates a unique intersection between international tourism, port operations, and the healthcare needs of the local community. Through the Medi Port Social Health Fund, businesses and major organizations can help establish the first fully integrated MedSpot in a European cruise port. The project transforms Κατακόλου into a gateway not only to tourism, but also to healthcare innovation. The Medi Port Social Health Fund offers partners the opportunity to support a highly visible and socially meaningful health project. The initiative combines global innovation, practical community benefit, and measurable value for participating organizations. Sponsors are not supporting a theoretical concept. They are helping activate a real healthcare infrastructure that serves cruise visitors, port personnel, and residents of Ήλια. It is an opportunity to become associated with a European first from the moment of its creation. There are 3 strategic reasons to participate. First, the sponsor becomes connected with a pioneering healthcare model at a major European cruise gateway. Second, the funding generates direct social impact through free telemedicine services, e-nurse visits, and healthcare support for vulnerable groups. Third, the sponsor receives measurable brand and CSR value. This is not conventional sponsorship. The partner becomes a founding ally of a new destination health model. Every contribution activates 3 interconnected areas of healthcare. It supports the operation of the MedSpot inside the port, including first aid, telemedicine, and immediate clinical assessment. It also funds social healthcare services for vulnerable residents throughout Ήλια. And when transportation is required, it supports safer and more affordable access to ambulance services. One investment, therefore, creates value both at the tourism gateway and within the surrounding community. The program delivers practical services with immediate and visible outcomes. Residents can receive free telemedicine assessments, vital sign monitoring, and e-nurse support at home. Patients can also access medical guidance and second opinions through a wider network of physicians. At the same time, the program supports cruise passengers, port employees, and the local population. The sponsor is therefore financing an operational healthcare network, not an abstract promise of future impact. The sponsorship model has been designed to provide clear and credible brand activation. Depending on the participation level, the sponsor may receive logo placement at the MedSpa, visibility across websites and social media, inclusion in press releases, and an official presence at the launch event. The partnership is also documented through photographic and video material and an annual CSR report. Visibility is connected directly to a real social outcome, making the communication more authentic and valuable. The return for the sponsor extends beyond visibility. The organization receives a measurable CSR report, access to selected corporate healthcare benefits, and the option to associate its name with a specific social health initiative. This creates a stronger form of brand positioning. The sponsor is not merely displayed beside the project. The brand becomes connected with prevention, accessibility, innovation, and direct community support. That association can create long-term reputational and strategic value. The program offers 2 distinct participation models. The first is comprehensive sponsorship of the MedSpot, supporting its overall operation and visibility. The second allows a company to fund specific healthcare services for selected citizens or vulnerable groups. This flexibility lowers the entry barrier and enables organizations of different sizes to participate. A partner can either support the infrastructure as a whole or finance a clearly defined number of healthcare interventions with measurable beneficiaries. The MedSpot sponsorship packages combine high-visibility brand positioning with genuine social impact. The port welcomes a significant international audience, creating continuous exposure to cruise passengers and tourism stakeholders. At the same time, the sponsor becomes associated with the first integrated telemedicine and healthcare point of its kind in a European cruise port. The value lies in this combination: international visibility, healthcare innovation, and a direct contribution to the host community. The sponsorship structure is divided into clear strategic levels. The founding or strategic sponsor supports installation, equipment, and social programming, receiving the highest level of visibility and the possibility of naming a major initiative. Gold sponsors fund free assessments and operating costs, while silver sponsors and supporters contribute to specific services and prevention activities. This tiered model creates diversified funding while offering every partner a defined role, clear benefits, and measurable social results. The media sponsor plays a critical role in expanding public awareness and social participation. Through television, radio, reporting, and digital publishing, media partners help communicate the services available to the community. The contribution can be provided in kind rather than through direct funding. In return, the organization receives healthcare-related B2B benefits and becomes part of a high-impact public interest initiative. Communication, therefore, becomes an operational component of the project, not simply promotional support. The detailed sponsorship framework allows each organization to select the level that best matches its strategic objectives. Benefits may include central branding, logo placement, participation in launch events, sector exclusivity, visibility at MedSpot activities, and discounts across e-nurse, ambulance, and medcare services. The higher sponsorship levels offer greater visibility and stronger corporate healthcare benefits. This creates a transparent commercial structure in which the partner understands exactly what it supports, what it receives, and how its contribution will be documented. For companies focused primarily on community impact, the program offers targeted social contribution packages. These packages support elderly people, patients with chronic conditions, persons with disabilities, and residents of remote areas. The service is delivered through e-nurse visits, telemedicine connections, and clinical monitoring at the patient's location. This allows a sponsor to convert a defined budget into direct healthcare access for people who may otherwise struggle to receive timely medical support. The Adopt a Health Service model makes the social return completely transparent. A contribution of €1,500 can fund 23 free medical assessments. €3,000 can support 47 assessments, while €6,000 can provide 95. A contribution of €10,000 can support more than 160 interventions. The sponsor knows exactly what is being delivered and receives a report documenting the healthcare services generated by the contribution. The social packages can scale according to the organization's budget and impact objectives. They range from targeted home-based telemedicine assessments to larger programs serving hundreds of beneficiaries. Eligible groups include people with disabilities, vulnerable households, bedridden patients, elderly residents, chronic patients, and individuals with limited access to healthcare. Special programs can also be created for cancer patients and other high-need groups. This transforms corporate funding into a structured, measurable, and highly targeted healthcare intervention. The final outcome is a complete care pathway built around 3 coordinated services. The MedSpot provides assessment and examination at the port. The e-nurse service extends clinical support and telemedicine into the patient's home. The ambulance provides immediate transportation and continuity of care when escalation is required. These are not isolated services. Together, they create a connected health network that follows the individual from first assessment to medical guidance and, when necessary, safe transportation. The technological core of the model brings more than 10 clinical examinations directly to the patient's home. Through the TytoCare Pro system, the e-nurse can collect vital signs and perform examinations of the heart, lungs, ears, throat, and skin while connecting live with a physician. The technology is FDA cleared and CE marked. This enables high-quality remote clinical assessment outside the hospital and transforms telemedicine from a video call into a genuine diagnostic experience. Inside the med spa, the same technology creates a complete point-of-care environment. The clinical team can evaluate cardiac and circulatory function, including heart auscultation, pulse recording, and 12-lead ECG capability. It can support respiratory evaluation, oxygen saturation measurement, ENT examination, skin assessment, and vital sign monitoring. Additional laboratory or imaging pathways can be activated when required. The result is a compact but highly capable clinical unit connected in real time with medical specialists. The e-nurse service brings healthcare exactly where it is needed. It can operate on board a ship, inside a hotel room, at a private residence, or within a company. The process is simple. A request is received, the nurse visits the patient, vital signs and clinical data are collected, and a doctor is connected through telemedicine. The outcome may be medical guidance, treatment instructions, or organized transportation. This mobility significantly expands the addressable market of the Medi Port model. When transportation is necessary, the ambulance completes the healthcare pathway. It supports port personnel, visitors, cruise passengers, and residents of the wider community. The process moves from initial assessment to stabilization, transport, and coordinated hospital admission. Medical guidance can continue during the transfer, ensuring that the patient is directed to the appropriate level of care. For a destination, this reduces uncertainty. For a sponsor, it supports a highly visible service where every minute can matter. This is an invitation to participate in one of Europe's most innovative destination health projects. The MedSpot at Catacόλου introduces a new standard of care at the gateway of international tourism. It combines physical infrastructure, telemedicine, mobile nursing, and ambulance response in one integrated system. More importantly, it provides a model that can be replicated across other ports, islands, marinas, and tourism destinations. The innovation starts in Κατακόλου, but the opportunity extends far beyond one location. Activating a sponsorship is designed to be simple and transparent. The first step is selecting the sponsorship level or healthcare action that best fits the organization. The funding is converted into operating healthcare services, prevention, and community support. Finally, the sponsor receives an impact report, communication material, and CSR documentation. From the beginning, the partner knows what is being funded, what will be delivered, and how success will be measured. Emergency Help provides the operational experience required to deliver this project successfully. The company has more than 10 years of expertise in emergency pre-hospital care, strategic collaborations with insurance organizations, and access to advanced telemedicine technologies. Its track record includes more than 84,000 healthcare coverages, a fleet of more than 15 ambulances, 5G-enabled telemedicine capabilities, and pilot applications in Greek municipalities. This experience significantly reduces execution risk and supports the future scalability of the Medi Port model. Medi Port is more than a healthcare point and more than a sponsorship opportunity. It is a new infrastructure model connecting tourism, emergency response, telemedicine, and community care. For strategic partners, the opportunity is to participate at the founding stage of a model with measurable local impact and significant potential for replication. Together, we can make Κατακόλου the first reference point of a wider European network of intelligent health ports. Medi Port, where healthcare innovation meets tourism, safety, and social value.